All right, to your health this Monday morning. You know, last winter the U.S. faced what we call the triple-demic. So that was a respiratory illness circulating, RSV, plus the flu, plus COVID. But here's the deal. RSV is an issue this summer. Haley's here to tell us a little more about that.
Yeah, isn't that crazy? So a local doctor says that she's already seeing signs of RSV. She was in the Clear Lake area. And traditionally, we know that this is not a summer virus, but the pandemic has really thrown viral patterns off. So joining us to discuss a new RSV vaccine for people 60 and older, Dr. David Persse, Chief Medical Officer with the City of Houston. Good morning, Dr. Persse.
Good morning, Haley.
So, we typically think of RSV as a virus that makes it difficult for babies to breathe. But what exactly is RSV? Who can be affected by it?
Yeah, so RSV, respiratory syncytial virus, is very common. It usually causes cold-like symptoms, and most people who are infected with RSV will experience a mild illness, and they'll generally recover with 1 to 2 weeks a time. However, for infants, young children, and older adults, those with chronic heart and lung disease, those who live in nursing homes, long-term care facilities, or the immunocompromised for whatever reason, they're at higher risk for a much more severe illness that comes with the RSV infection. RSV can also cause pneumonias and bronchiolitis, and this is where folks often wind up being hospitalized. And in fact, every year we see between 60 and 160,000 hospitalizations here in the United States from RSV. And unfortunately, of those folks who get hospitalized, between 6,000 and 10,000 of them who are adults will pass away as a result of this infection.
Wow. Can you tell us what are some of the symptoms? Are the symptoms different between children and adults?
So, well, not really. So generally, as it starts off, it's really, you're going to get about 4 to 6 days after you're exposed, you develop symptoms. That's one problem. We'll talk about that in a minute. But it's a simple cold-like symptoms. It's runny nose, it's a decrease in appetite, coughing, sneezing, fever, wheezing, and just generally feeling crummy. That's how it generally starts. And like I said, most people will recover from that. Some people, unfortunately, will go on to have a much more severe illness. And the symptoms usually, the person is usually contagious for 3 to 8 days, and they may in fact become contagious before they show symptoms. And so this is why it's really difficult to stop this virus. Mm-hmm. If it was like some viruses where you only can spread it after you show symptoms, people could, once they show symptoms, start isolating themselves so they didn't spread it. But unfortunately, RSV is one of the few viruses that where you will spread it before you show symptoms, making it more difficult. And hence, vaccines would be really helpful in this case.
Because like you mentioned,
there are some tests that you can get to confirm the RSV virus, but they're all from a healthcare professional. We don't have any over-the-counter ones yet. So if you think you've got it, you need to get a hold of your doctor or your medical home to find out about getting tested.
Yeah, and so when are they going to have that vaccine too, and who would be eligible for it? Do you know more about the vaccine?
Yeah, so first of all, the good news is, the exciting news is that we now, this year, for the first time, we're going to have some vaccines available, the 2 of them, for RSV, and they'll be available in the fall, just in time for this fall season, the viral season that we're going to see this fall. And they will be available coming up soon. One is made by Pfizer. It's called Brisvo, and the other one's by GlaxoSmithKline called RSV. So I would recommend the folks, particularly, and these are for people over the age of 60 at this point. So for those folks over the age of 60, and particularly if you're over 60 and you've got heart lung disease, you've got immunocompromised situation, talk to your doctor and seriously consider getting vaccinated against RSV. Not only will you protect yourself, but again, like with all vaccines, you then reduce the chance that you're going to spread it to somebody else, like an infant, your grandchild, as an example, who you don't want to get sick with this virus.
Yeah, the young and the old sometimes are in close contact, just like that. So do you predict that this season is going to be bad? I mean, we saw a really awful RSV season last year. Do you think that this season is going to be anything like that?
Well, it's one thing I've learned through this pandemic is if you want to make a mistake, make a prediction, right? So COVID has thrown the whole viral infection timelines off. We've seen RSV in the summer, which we almost never saw that before. We had a couple of years with almost no flu, followed by a year with lots of flu. So it's really hard to predict. But as things are starting to normalize, COVID is coming down. It's not gone, but its influence is coming down. I do anticipate that we're going to go back to what was the normal pattern. So I do expect us to have at least a normal RSV season, but we have seen some pretty bad RSV seasons in just the last couple of years, and they were at the wrong time of the year. So it's hard to predict, but I would count on us having RSV this fall for sure.
All right, and then that's the time to ask your doctor about the new vaccine. So thank you, Dr. Persse, for enlightening us about that. We always appreciate you joining us on a Monday morning. And of course, you can watch this full interview on click2houston.com.